half of the children I receive every day at Nasser Hospital, they're dead by the time they arrive to the emergency. And so I gathered, his family and beside him, right, started to talk about this. It was quite difficult for me to explain them, we have to do amputation now. But then, he would just cut you off and say, doctor, don't make it difficult on you. You want to amputate my my leg? I said, yes, just go ahead and do it. And hopefully, inshallah, it will go to Jannah before me. Children of Gaza grew up and became men and women. They're different than our children. And the way they talk, the way they discuss things with you, because they have gone through a lot of difficulties and they have seen the killing and the shelling and the bloodshed, they became tough. It is, amazing how a child in Gaza can carry such a critical and important kind of discussion when you talk about his health or her health. And I think they have developed a lot of faith and belief that probably we lack.
Welcome, everyone, to the Life Haqq podcast. Today with us, we have a special guest in a special place. We have Dr. Anas Al-Kassem here from the newly opened Palestinian Cultural Center. Welcome to the podcast, Dr. Anas.
Thank you, brother.
So, Dr. Anas, I just want to quickly start off with you just introducing who you are, your qualifications, and the organization that you work with.
So thank you very much for the opportunity. My name is Anas Al-Kassem. I'm a general trauma and bariatric surgeon. I graduated from Ottawa University and then been practicing now for almost 15 years in Ontario, in Ancaster near Hamilton area. I have been going on medical missions for almost 15 years now. Started with ICRC and MSF, and then we set up our own medical relief organization. It is called OSSM, UOSSM, abbreviation in French, as the headquarters is in Paris. But we have chapters in many countries, 8 countries in Europe and North America, including Canada. The head office is in Toronto, but I'm currently serving as the chairman of the international organization.
Okay, and as part of that mission, we find ourselves, coincidentally enough, in the Palestinian Cultural Center. You have missions to Palestine, more specifically with the humanitarian crisis in Gaza. Is that correct?
Correct.
Okay. Now, we were just briefly speaking about something that went viral last week with one of the most famous podcasts on the Joe Rogan podcast. There was a debate between somebody representing the Palestinian side and somebody representing the Zionist position. And this boy wonder, boy genius, Douglas, more degrees than a thermometer Murray, said that somebody can't speak about the situation. They can't speak about Gaza if they haven't been there. You can't be an expert or an authority. It turns out that you have been there. So you can speak about this because according to him, that is the prevailing condition. And I want our viewers to appreciate the journey, the difficulty of how hard it is to access Gaza in the first place. So can you enlighten us? Can anybody just go to Gaza? Like if I want to go firsthand, I study Gaza, I get a degree and in history and politics and all that stuff, and I want to go to Gaza. Can I just show up in Gaza? Like, what do you have to do?
Yeah, you can, unfortunately.
Yeah.
So there's a longer screening process. You have to apply, and we do it through our organization. You need then connection through either Egypt or Jordan. You need to apply and coordinate with the WHO. You need to apply and coordinate with the COGAT from the Israeli part. It's a big process. But then just like a couple of weeks ago, 5 of our members went there. They were cleared. Everything was fine in Jordan. And then all of a sudden they told them at the border, you're declined. So there's still, possibility that you're going to do all the process, everything.
Go through the whole
buy
procedure.
the book, and you go there, you show up, and they tell you, sorry, you're declined. So, but going from Egypt is a completely different story than going through Jordan. I went through both. Egypt's a longer trip. You're going through Sinai, desert for 14 hours, a lot of checkpoints, but at least there is no interrogation, right? Going from Jordan, because you're passing through West Bank or Israel, whatever you want to call it, right, occupied area, then there are a lot of, checkpoints by the Israeli kind of security and checkpoints by their soldiers. And this is where probably you're going to be interrogated multiple times, and, they're going to check your luggage. They checked my luggage in the last trip 5 times.
Wow.
And every time they just take everything and have just like some insulin with me and some medication. They saw everything, they would throw them and they said, you tidy up. And then the next person will say, okay, we're going to do the same thing. And then they throw them on the floor and they say, you tidy up. I think the message is that to make it, when you wait 5 hours, when you're tired, exhausted, it's almost sunset from the morning, you've left Jordan, they want to make it difficult on the physicians. Even if you're cleared, everything is fine by all these parties, right? There's nothing against you from the safety and security standpoint, but they want to make it difficult. So probably you're going to decide, I'm not going to go again.
Yeah. There's probably a humiliation aspect to it, harassment aspect. I know many Canadians are avoiding to travel to the US because of the trade tension, tariff issues that are happening. They're avoiding to go, and I can only imagine how that's dialed up to like a 10 when you have to go through some of these checkpoints, like multiple checkpoints. And many people are just avoiding the US. They have homes in the US and they're selling their homes because they don't want to be humiliated. So it's obviously a tactic that works. Like when you're harassed, people don't want to go there.
Absolutely.
But you persist, obviously, because you have a higher purpose. You're on a mission to help people.
And to be honest with you, in the last trip, they were, harassing us and, taking the insulin. What you're going to use it for? They take the insulin. It's insulin, right? What are you going to use it for? Are you going to use it for the children or adults? He asked me, right, the soldier. And I said, both. I'm going to be honest. It's not only children, right? If I have a woman or someone, even elderly, he needs insulin, has diabetes, and they go and they check it and they use the barcode and this and that, and it takes half hour and then they, okay, you're fine now. But as you said, this is probably a tactic to make it difficult on you. So probably you're going to say, hey, I'm not going to go next time.
Yeah. Who wants to deal with that, right? And there's obviously that difficulty as you're going. So, is there times, like how long is that process to get permission to go there?
So it can take anything from 4 to 12 weeks.
4 to 12 weeks.
As long. Okay. So if I want to go now, I'm planning for probably July. Probably this is the best time now to apply now. But it's still, as I said, you can do everything. The problem, you can take a vacation. You're leaving your work for 3 or 4 weeks, right? You're unpaid, of course. This is all volunteering work, and then you can show up with all, everything, all being accepted and approved by all parties, and then you can show up at the border and they can tell you, sorry, you're declined, and they don't tell you why.
Yeah.
Right. This is how it's. But as you said, you're doing this for a higher purpose. I think it is an obligation on us. It is a duty. I don't even call it what I'm doing is a charity. It's not a charity. It's a duty on every person who can help. Right.
Yes.
I'm a surgeon. I'm trained in foothills as a trauma surgeon, and I had the honor to serve the senior people, Syrian people, for probably 13 years through ICRC, MSF, and then our own organization. So I gained some set of skills, and I think I should transfer them and try to save the children of Gaza and help the wounded of Gaza.
And I noticed you said you have these skills. You feel bound by duty to help the children of Gaza. Now, because I want to make it relatable to people. So here, for example, if you were to see a child that's suffering, and obviously we have really good health care, but just say, for example, that it wasn't covered by health care. They wouldn't be able to pay for it. As a human being, somebody who has a beating heart, would you feel compelled to give life-saving surgery, even if you weren't getting paid for it here for a child here in Canada?
Absolutely.
Okay.
Absolutely.
And I think many people, if they have the ability, you have the skill. So if I have the ability to save a child, say for example, there's a child fell into the well. There's many famous stories, right? A child falls in, the whole town comes together to try to save the child. Even if they don't know the child, it's something deep within you. You don't ask the nationality of the child. You don't ask the color of the child. You don't ask the child if that, he's a good boy, good girl, bad. It's a child. I want to say, right? And now when you go to Gaza, what do you witness? What have you witnessed that has made you feel so compelled for you to leave Canada, for you to leave your family, for you to leave your job, your income, possibly put your life on the line to go help these, children of Gaza? Because many people say, why should we care? So why do you care?
No, that's a very good question. Every time I go there, I feel I'm more compelled that I have to go there again and again, to be honest with that. And that's not only me. Every surgeon I met in Gaza, they're coming from UK, from US, from Canada, from anywhere, they have the same feeling. And they feel that before that, they have been ignoring, the reality and not really doing their duty. And they feel that they have to go more often and encourage other people to go with them. You feel that kind of obligation. And I can give you just an example because, the minute you go to Gaza, the last, visit, I was in Khan Yunis Hospital, Nasser Complex, one of the largest, medical complexes in southern Gaza. And you wake up every day, it's the same story. Most of the injuries are children. I would say 50%, that's my own data at least, right? I was just really trying to make data for my own. So about 50% are children. And the children, when they get stuck beneath the rubbles for hours and hours after night, they don't have the ability to survive. So someone who's adult probably can survive more than these children. So that's why.
So they're being crushed by parts of the building, and they're slowly dying. Many of them don't just die instantaneously.
So I think, in my own assessment, that probably 80 or 90% of the injuries are salvageable, and you can save their lives if they, reach the hospital within an hour or so. But the problem, when they crush, a building and there are a bunch of rubbles at night, it's pretty risky for the ambulances to go there, right? Because if there's any light, going in the streets of Gaza, that's a target by the drones or by, the tanks. So they feel they're targeted. So most of the time,
medical workers are being targeted.
100%. And so if they try to go in the middle of the night, right, to get some bodies from beneath the rubbles, they will be targeted. So that's why, it's almost like a schedule. At 7 a.m, we will have, a lot of children coming to the hospital. Most of them probably being hours and hours beneath the rubbles. And I asked this question. They said the ambulances cannot even, they don't dare to go there in the middle of the night, right? Because they will be targeted. So intentionally now these children have been forced to stay beneath the rubbles for hours and hours. And so if someone is bleeding, I'm a surgeon, right? So we know there's something called golden hour. You need really to reach the hospital within an hour to stop the bleeding. My job is really to stop the bleeding, right? That's how I'm a trauma surgeon. This is how I'm trained in Calgary to do. So if that child, stays for a couple hours, 4 hours, 6 hours sometimes, in order for the ambulance to be able to reach them safely and get them to the hospital, most of the time they would have bled to death, to the point that half of the children I receive every day at Nasser Hospital, they're dead by the time they arrive to the emergency. And
just because you can't get them.
Just because you can't get there.
Although you have the ability, but you'll get killed.
100%. So even if they're bombing, let's say they're bombing, an area where they suspect there's some movement or something against them, right? I'm not going to argue. But they should allow us and the medical crews to get to the scene, to get there, to get, the children at least and the people beneath the rubbles to the hospital. They want, right? You'll be targeted if you do that. And so just because of that delay in the response to bring them to the hospital, we lose. And that's why you hear that 50, children died every day, 60 children died. Many of them would have been, saved if you have the ability to reach them safely, if they allow you to reach them, to get them to the hospital. That's the tragedy in Gaza. It's more than the injuries itself, is to be able to get to the injuries in order to bring them to the hospital.
They say statistically that the children that have died in Gaza has been more than any modern war times 4.
Right.
And you're saying from your firsthand account, you can attest to that is actually a reality.
I do. And I have been in the Syrian war, right? Probably that will give me some credibility, because this is one of the worst wars as well over the past decades, right? From the World War, probably even. So I have seen a lot of, injuries in the Syrian war. But I've said this before in the media, that Gaza is different in two different, kind of contexts if you compare that with the Syrian war, for instance. Number one, it's very tight and highly populated, because you're talking 10 by 40 kilometers. Like, I was able to go from east to west within minutes. Right? It's like you look at Edmonton greater area. This is Gaza Strip, right? 10 by 40 kilometers. And so it's very tight. And imagine all these bombs, right? It's like Hiroshima, they said multiple times now, have been thrown on Gaza, right? Everyone talks about Hiroshima, but this is way worse if you take it collectively over the past year and a half. So all these bombs, some of them are 2,000 pounds. The last trip when I went to Gaza, it was different from the previous mission. I found, areas where, there's probably a huge gap in the ground over kilometer or so. And I asked them what's going on there. They said they have thrown one of these 2,000 pounds, bombs. You don't see, any evidence of buildings or anything like left behind, right?
It's just rubble crushed.
So that's number one. It's a very crowded area, highly populated, and then 10 by 40 kilometers. And the second difference than probably any other war that I've seen before, at least myself, is that you don't have the ability to, because they closed the border, to transport these patients to Egypt or to Israel. You just have Israel, you have Egypt and the sea, right? That's it, right? So if the Egyptian border is closed and the Israeli border is closed, the people likely will die if you don't have enough resources. Even in the Syrian case, it was very aggressive. I can't deny that. But at least we had Turkey, for instance, open the door for us, right? So we were the complex cases, the difficult cases. Because remember, in a war zone, I can only do so limited things, right? Because I don't have the ability. I have little resources. On myself, as a medical crew, we are under attacks and it's risky. So we can do limited things. I know how to stop the bleeding if I receive the patient early on, right, on time. But then if we need complex, kind of complicated procedures, then we don't have the ability to do that. And unfortunately, in the Gaza war, the patients are not allowed to go to Israel or Egypt to get the treatment. So even if you survive the first day or two, but if you need really, high-end procedures and you don't have the resources to do them, you're going to suffer and likely you're going to die in a few weeks in Gaza.
I can't imagine what it would feel like for a parent to try to just watch their child suffer like this in front of them. Here in Canada, we complain about the wait times. And myself, I experienced, taking my daughter to the emergency room. She had a cut, trying to get stitches. You're waiting for hours. You're frustrated. But alhamdulillah, it's not life-threatening. If it's life-threatening, you would go insane. You'd probably break down the walls trying to get somebody to, help your daughter. I can't imagine knowing that just because of the brutality of not allowing even children to get basic medical care, that they would be essentially being tortured to death, like the life being, taken from them just by this brutality, right? What is one of the images or experiences treating some of these children that has stuck with you?
The most difficult thing for me as a surgeon is when you receive, a patient, a child with multiple injuries, but no parents come with that child. In Canada, you have the luxury to talk to the parents if someone's coming for appendectomy or for burst appendix or something like that, or twisted bowel. So, and they can ask you all the kind of questions. That's the right, and they can approve or disapprove the surgery. But almost every time in the first day, the last mission I went to Gaza, I did 4 surgeries on a children without meeting their parents. And that's the right of any child, to have his or her parents to make the decision on their behalf. If someone's 4 years old, who's going to make that decision? But because, the parents either died or maybe injured as well, right? Or they can't even reach the hospital. In many occasions, you'll receive the child with multiple injuries that you have to make a quick decision. But I'll make this decision on behalf of the parent. And in all of these cases, you don't have the luxury to talk to anyone. You have to make your best judgment and go to the OR without any consent. That's so hard. And then when the child wakes up from the surgery, I try to find who is the parent or who brought that child, just to tell them what has happened to the child. And sometimes, imagine, I could not even find any relatives, but a neighbor maybe or someone came and he's asking about that child. So I have to relate this to the neighbor because there's no even relatives left behind. In the area or in that region where that building or that tent was hit. As a human being, this is the most difficult thing for me, because again, as a surgeon, I can deal with the blood. I know how to stop the bleeding, again, if I receive the patient early on, but it's so hard. I'm not trained even in Canada to deal with a situation where you have children coming with no parents, with no relatives, and you have to use your best judgment to do the surgery that you think is the best for them. The situation becomes more complex if I have to do amputation. And I did amputation without a consent from parents. But I have to use my best judgment. And I say, God forgive me if I did something wrong, because this is, a leg that, it's just bleeding to death. And I think if I don't amputate it, it's going to cause more infection, and it's going to probably spread into the rest of the body, and I'm going to lose that child. So we did amputations even without a consent.
So children are being amputated.
100%.
Is this a common thing that's happening?
So in Gaza, my estimation from our organization, we have about 5,000 amputees, and about 40% of them are children.
Wow.
So that's about 1,500 to 1,800 roughly amputees. They're all children. It is very common on a daily basis to do 2 or 3, amputations. Very common.
Every day.
Every day, in each hospital. That's very common. And the problem, as I said, sometimes you don't have relatives, you don't have parents to have this very important discussion about such a critical decision.
How are these children processing this? So I know for you, I think, the way that we're trained here in Canada, you have this link with the parents, because I think innately you understand that the parents, there's an advocate. No one's going to advocate for a child like their parent. And when that's missing, then that huge support structure is absent. How are the kids processing this?
It's so hard, but to be honest with you, the children of Gaza grew up and became men and women. They're different than our children. The way they talk, the way they discuss things with you, because they have gone through a lot of difficulties and they have seen the killing and the shelling and the bloodshed, every day before their eyes. They became tough. And sometimes you think this is a difficult kind of discussion with a child, but they have seen the blood. They have seen losing some of their family members before their eyes. It is amazing how a child in Gaza can carry such a critical and important kind of discussion when you talk about his health or her health and what has happened to them and what you want to do in the next few days, especially if they have lost their parents. It is tough on us, to be honest with you, but they're strong and I think they have developed a lot of faith and belief that probably we lack, to be honest with you. This is my only explanation.
Their faith is what is keeping them
100%. 100%.
preserving themselves, their sanity, probably.
100%, because every time I wake up a patient from the OR, a child, going to the ICU, they say Alhamdulillah, they don't scream, they don't cry. It's difficult to understand. It's a different kind of understanding for the children, how they behave usually, right? But they're different than our children, for sure. I can tell you this.
So they're showing incredible resilience in the face of obviously this onslaught. Now you said that there's these families obviously that are broken apart. There's many orphans. How is this community functioning? Are they just in survival mode? How do they function? Because I want us to get our head around it. Because for us, a normal day looks like your kids are going to school. You feed your kids breakfast. You're worried about them going to school on time. Oh, I have to get them new shoes. I have to, get them books for school. And okay, did you do your homework? You got soccer practice. You're going to get together with your friends this weekend. You're going through all these different motions. What is their life like? Yeah. How do they cope? What is their daily life like?
I mean, you're absolutely right. I mean, if a child goes through major surgery, liver surgery, losing their kidney, their leg with amputation, what kind of life they're going to have right after that? And we have hundreds, if not thousands of them now in Gaza. And the difficulty is that you don't have enough rehabilitation programs. You don't have enough physiotherapists to take care of them. You don't have enough psychosocial supporters, right, to take care of them. They need all that. If we do one amputation in Canada, and I've done very few in my whole career, more than 15 years in Canada. And probably I do in one day in Gaza more than I have done in my whole career in Canada. But even if you do one amputation for a child, oh my goodness, you have all the resources and you have, the rehabilitation, the physiotherapy, as I said, and everything, mental health support. You need a lot of resources for someone who has gone through amputation. You don't have that in Gaza. Right? You don't have that. But you ask me, how do they survive? The community itself is just amazing. I mean, you can find some people from neighborhood, if there's no parents, as I said, another neighborhood, he would come and say, okay, I'll take care of that child. I'll bring this child to my children, to my tent. There's no houses left in Gaza, but I'll bring them to my tent. I'll take care of that. I'll do this. I'll take care of the medications of this child. I know his dad. It's just amazing how the community is surviving. It's just the community.
They're just giving to each other.
Because the countries, the governments are doing nothing, to be honest with you. There are a few medical relief organizations like ours. There are good charities trying their best. But we're talking about a catastrophe, right? As I said, like Hiroshima multiple times, and you have 2 million people trapped, and almost every family, they have either multiple injuries, and multiple people with amputations. Every single family. So you need the international community, you need countries, you need governments to put funds and resources to help 2 million people. It is the community helping each other.
It's the grace and generosity that they have with each other.
100%.
It doesn't seem like they're the evil, murderous, community that they're made out to be, deserving of this hellish nightmare.
I can tell you, I lived with the people of Gaza. I lived with the nurses. I lived with the doctors, with the patients, with their families. They're the nicest people I've ever met, right? And to be honest with you, they just want to get along with the Israeli and with the people, next to them. They want a freedom. They don't want to be always oppressed. They want to be able to live their normal life. Everyone tells me the same story, right? They've been oppressed from 1948 until now, and they just want to live like any normal person. That's in terms of education, being able to travel, having a travel document, having access to universities, all these things. That's what been derived from. So to me, I think they are not normal people. They're the nicest people I've ever probably met.
I don't know if you've seen, there was this viral, I don't know if it was a TikTok or Instagram video where there was a new immigrant from Palestine here, in Canada, and somebody has this YouTube channel where they try to do nice things for people. So he tests them first. So he went into this this Palestinian family, asked them for some money. He's like, "Oh, I'm hungry, I want to eat," and they were giving him money, even though they just came to this country. They were so generous.
Well, talk about generosity, I tell you one of the stories, when I was in Nasser, initially we were not fasting, but then I figured out, there's no food and the Palestinians themselves, they're fasting, right? So
Yeah.
I felt, shy. So with, people coming from US and Canada, we started fasting with them. And then sunset comes and we didn't know what to eat. And I don't feel, even, have the courage to ask them because I'm one of them now, right?
Yes.
If there's hunger, there's hunger. We don't have food. And then someone would come from the neighbor, tents beside the hospital and bring us food, right? The first night, the second night, he just knew that there are new physicians coming
Wow.
from US. And then I asked him, I said, can you tell me, brother, where are you getting this food from? This is beautiful food. One of the best food I've ever tasted, the best rice I've ever tasted in my life. By the way, Gaza, they have one of the best food, the people there is amazing food. But the flavor is amazing. And then he said to me, my wife is cooking this. And I said, where do you live? He said, in a tent. I said, how do you cook this?
Yeah.
He said, on wood.
Yeah.
He doesn't have gas. There's no electricity. And he's getting the rice from some people, generous people in the community, because they knew there are physicians coming to help them. And she's cooking on the wood outside the tent, right? Setting fire and cooking some rice for us.
Yeah.
And he kept doing this every day.
Yeah.
Right? It is amazing.
Yeah.
Right? It really reminded me about some of the companions of the Prophet ﷺ, right? Years ago, right?
Yeah.
When it was narrated, when they in the battle of Al-Ahzab, when they had no food at all. And one of the companions, his wife, he said, whatever we have, just cook some food, and we're able to feed everyone.
Yes.
Right? And there was some food left over.
Yeah.
There's barakah. And every day they would feed us food, and there's some food left after after we finish. It is amazing.
Yeah.
So these are stories, just it shows you the generosity you're talking about of the people of Gaza.
Yeah, it reminds me of also that incident. It's mentioned in the Quran as well. وَيُؤْثِرُونَ عَلَى أَنفُسِهِمْ وَلَوْ كَانَ بِهِمْ خَصَاصَةٌ, that they give even though they're themselves in need, right? Like the Ansar, they would give even like they needed themselves, right?
It's so true, 100%. I mean, if you go to the tent of this gentleman, they're so poor. They lost their house in Gaza. He's from Gaza City. They have nothing left behind. He's always smiling.
Yeah.
He's always bringing us the food at sunset, right, to break our fast with open heart, right? And so as you said, yes, they're living the Sunnah. They're not just educating themselves about it or reading the Quran. They're living the Quran. They're living the Sunnah.
You mentioned the amputations. Are there amputations being done without anesthetic?
I haven't done anesthesia with it, but I have done suturing on the floor, right, in the European hospital without anesthetic. So, and so when there is a massacre, when again you have like influx of 20 and 30 children coming together and loss of bloodshed, so of course the critical cases would go to the OR. But then imagine, you're going to have a lot of, injuries, probably mild to moderate, that they need suturing, they need some basic care. We don't have the stretchers. We don't have the ability to take them to the OR. Ideally, everyone should go to the OR, right? More sterilized, and you have the equipment, and you have anesthesia, answering your questions. But I had to do suturing on the floor in the ER department in the European hospital without any painkillers, because we would save them to the OR, and you don't have plenty of anesthesia drugs and painkillers, IV painkillers. So just like suturing them, and I would just try to chat with the children. One day, Sufyan, I still remember that name. He's probably 10 years old, and he had major laceration in his abdomen. I had to suture it on the floor. No painkillers whatsoever. So I said, can you read some Quran? And just like chatting with him, was reading some of the Quran, and I was just suturing his abdominal wall. So I've done that, not in the OR, but in the ER.
So you're suturing his stomach and the only comfort he has is reading Quran.
That's right. That's right. I mean,
And he's 10 years
subhanallah,
old.
he's 10 years old because
Wow.
it is subhanallah a habit, very common that the moms, in the tents always, they're reciting Quran and teaching their kids Quran. So this is the best thing you can is just read some Quran, or ask the child to read some Quran to give him some comfort and get him a little bit distracted from what you're doing, and I would suture his abdomen.
So his comfort, and for many of them, is reading Quran. Is that a common thing that you see, that they're comforting themselves?
Very common, very common. Even in the tents, people with amputations, adults and young children. I find them just reading Quran and getting themselves, just like getting distracted from the pain. I mean, with reading some Quran and doing some good things in the tent, because what else they can do?
It must be a powerful thing for them to be able to cope through all of this, because there's not only the physical component, but I can't imagine the psychological effect of having to deal with all this trauma.
Absolutely. And I think, I've said this in the khutbah, and I always say this, I think Allah subhanahu wa ta'ala, He chose the people of Gaza. I mean, if it was me, I can't probably go through it, right? If it was my family, talking about myself. And I don't think probably any nation, right, any population can go through what Gaza is going through. I think God had chose them, right, for this, for a good reason, because they can tolerate, they have the patience, and God knows that. The perseverance and the patience that I've seen from the people of Gaza, from the children of Gaza, is really unheard of, and I've never even imagined, not seen for sure. I've never seen this, but I never even imagined or heard of this kind of patience.
What's one of the most memorable things that keeps coming into your mind of your experience there?
Oh, I mean, there are a lot of memories, but one thing, is that there is a 20 years old gentleman with a lot of muscles, and he, his tent was attacked with a drone, and he sustained major injuries in his thigh. And so he was bleeding to death. And so 3 surgeons, a vascular surgeon and myself, another surgeon, we scrubbed in for 4 hours. And so we managed to put the vessel together. And then after, a couple of hours in the intensive care unit, the anastomosis, where we hook the vessels together, started to get clots. And there are some signs of dead tissue. And it was quite difficult, because we hoped that we saved his limb, and we have to go back to himself and his dad and his family to tell them likely we have to do amputation. And so I gathered, his family and beside him, right, started to talk about this. It was quite difficult for me to explain them, we have to do amputation now. But then, he would just cut you off and say, "Doctor, don't make it difficult on you. You want to amputate my leg?" I said, "Yes. Just go ahead and do it, and hopefully, inshallah, it will go to Jannah before me."
Wow.
So you're trying to make.
So he's saying, hopefully, my leg will go to paradise.
That's right.
Before
That's
I
right.
go to paradise.
So you're trying to make it easy on them, and you figure out they have way better faith than you. So he tells you, don't make it difficult. You don't have to go through all this.
He's trying to comfort you.
That's right.
When you're trying to comfort him.
That's right. That's
wow.
right. So this was shocking.
What kind of people are these?
That's right. That's right. Subhanallah. And there are some tragedies I can tell you about, some stories that when you finish, as I said, a surgery, and then you try to find the mom or the parents next day, and so I found the mom of a 4 years old that had major injuries in the liver. So alhamdulillah, surgery went fine. We had to do some suturing for the lacerations, and he was doing better and waking up next day. And then only then I had the ability to ask his mom, "Can you tell me the story, how the injury happened?" I wish I did not ask her, because she said he's the only one who survived, right? And I said, "Can you tell me what has happened?" She was in a tent, and she said, "My children did not eat for 3 days." And it really makes me feel emotional when I remember this, because we have, subhanallah, bounties here, and we can we have all kind of food and all kind of drinks that alhamdulillah we have in our houses and have access to. But she said for 3 days I did not have any food to feed my children. I said, so what happened? She said someone donated some wheat. So she was so happy and the children were so happy. So she went outside the tent. And so the 4 years, will follow his mom. The older children stayed in the tent with the dad. So she went outside and started, baking some bread, basically. They didn't eat for 3 days. And she said by that time a drone came nearby and hit the tent. And my other 4 children died. And the dad was in a critical care at that time. So she lost 4 children, only one. So the one I did the surgery on, he's the only one who survived. And I wish I did not ask her this question. But what really, made me feel bad about asking this question, she said, they did not only die, they died scared, they died cold, and they died hungry. And this is the story of our people in Gaza, is that they're dying hungry from depriving them from access to food. They're dying cold because there's no gas, there's no electricity, especially in the winter. It was winter time, and they were scared because of the destruction and the bloodshed and the ongoing bombing. And so it's not even the death itself. I find it's a crime.
Yes.
Right. The way they're killing them. Right. These are children. They should have access to food. They should have access to a comfortable life and to heat and gas and everything else. But they're not only dying with the bombs, they're dying hungry and scared and cold. So this is one of the stories.
Why don't they have food?
Well, so if you go now to Gaza, for instance, especially at that time when I was there in northern Gaza, there's almost no bread, no rice, nothing, because at that time they just opened the door for South Gaza, and I think they wanted the people to leave North Gaza and go south, so they can control the land north. So famine has been used for sure, as a weapon.
So it's being food supply is being restricted because, from what I understand, there are an outpouring of people trying to get food. There's trucks lined up. People are donating. I know this past Ramadan, for example, people are donating, and there's missions that are going out. But you're saying there's restriction of that flow.
So you can see the trucks when you go to Gaza. I've seen probably hundreds of trucks lining up, kilometers, right? Tens of kilometers maybe before Gaza, and so they decide, for instance, today nothing will enter, nothing.
Just arbitrarily.
That's it, right? And next day probably 50 or 60 trucks. And what you're going to feed? Like, we have 2 million people trapped. Before the war, I heard from the United Nations that they were allowing 700 trucks to enter. So if there's a war, you should probably allow double that number, right? So in a good day, they will allow 50 or 60 trucks. But then we hear all of a sudden, they closed the border and they said nothing will enter. So this is critical for women with pregnancy, for elderly people, and for children particularly, because these are the vulnerable people that if you don't really bring suitable nutrition for them, they're probably going to suffer from a lot of chronic diseases, and some of it you can't reverse it even within a few days or even a few weeks.
So as a first-hand witness, a medical expert, you can testify with absolute certainty that there is malnourishment, there's starvation that's happening.
100%. I mean, even the surgeries I've done on many children in Gaza, they don't heal well, because imagine this child did not eat well for a year or so, right? Or they're just eating one kind of food, maybe some vegetables, some access to vegetables, right? There's no carbohydrates, there's no bread, for instance, or there's no meat, for instance. That's for sure. Nobody has access to meat in Gaza. So to start with, this child had malnutrition before they come with a burn or with a severe injury. And people coming with burns, they need extra nutrition, they need extra care. And if you don't provide them with the nutrition, to the point one of the people in Gaza told me, and I couldn't even answer him. He said, "Doctor, thank you very much for what you're doing. You're suturing, you're stopping bleeding. But if you're not going to feed this child, how this going to benefit him?" And I could not answer him. He's so right. He's so right about it. I'm a physician, and I know that after the major surgeries, with injuries and with burns particularly, you need sometimes 3,500 calories, 4,000 calories. Me and you probably can survive regularly on 2,000 calories, but you need extra calories with high quality. And if we can't provide the children with the nutrition, they bug me, the moms, sometimes, that after the surgery, my child did not eat anything. And I wish that I could bring more, chocolate bars or protein bars or something, but even they did not allow me to get a lot of stuff with me, and this will end within a few days. So this was the struggle always, like, how can I, bring nutrition to the children after the surgeries and be sure that they're going to be surviving the surgery with appropriate nutrition.
To me, it's amazing with your account how people will say that some people would say that the people of Gaza are being spoiled, they have so much food, there's no restrictions. And what you're telling me is that they're starving, they're suffering. And it almost makes my heart explode, just as you were describing how this entire family is starving. And that moment you feel ease, we have some food, even greater tragedy strikes. Like, here we have a chance to finally eat. We come out of our tent, we finally have some food. And the mother's so happy. The child, of course, is following. I can just see that. I have a small child, and he follows his mom everywhere, right? She's cooking, he's following. I can vision this in the kitchen. They stuck in those first few years, and we feel this at Ramadan, right? Like, we're waiting for our wife, the wife, to bring food, cook. We're breaking
Even
our
as
star.
adults.
Yeah, even as
Right.
adults. I'm starving.
Right.
I've been working all day. What's
That's
for
only
dinner?
12 or 14 hours.
And then, subhanAllah, that moment of happiness is snuffed out because of a drone strike. How do we get the average person to feel any sympathy for these people?
As you said at the beginning, if you have a child or, even regular person, stuck here, and even if they don't have insurance, let's say, you're not going to get paid for that, or you see someone, falling before your eyes, you're going to be helping that, right? You're not going to ask whether you're Muslim, you're a Jew, you're black, you're white. You're going to be helping that. Any decent human being should be feeling for Gaza and standing with Gaza today. If you're not standing with Gaza today, with all the evidence that we have seen, with all the scenes that we have seen coming from the ground, with all people like me, going there and coming back and telling you what they see, that person is not a decent person. That's the only thing I can tell you.
There's, from our politicians here in Canada, I'm born and raised in Canada. Our politicians always talk about, we have great Canadian values. We stand up for humanity. We stand up for the environment. We stand up for justice. So you grew up on these Canadian values, growing up singing "We Stand on Guard for Thee." Okay, we have the anthem. We have all these different things, and it just amazes me to see that we have these firsthand accounts. And it's almost like we ignore these stories and we say, okay, let's focus on the terminology. Oh, this is not a genocide. This is, fighting terrorism. There's certain buzzwords and distracting, topics that people bring up. How do we get through this? I think one of the things myself personally talking to you right now is that you need to not now make any comment until you firsthand talk to people who have been there and are suffering. Come, like, talk to the people who have treated people like like yourself. You've treated patients there. Talk to the people that have escaped, from there and what they witnessed with family members and so forth. Because how can we allow this, to continue and then just think that we just say a few buzzwords? Okay, we can't politicize the word genocide. We can't, say these things, and the reality is kids are dying of starvation. The reality is surgery without anesthetic. The reality is orphans. The reality is families being wiped out. The reality is, people just dying out of starvation and misery and so forth. That's the reality. If you don't want to call it genocide, just call it something else. But that's the reality. It's absolute brutality and torture that's happening right now.
Well, but I mean, I always tell my colleagues in the Canadian system in the hospitals in Canada I work with, we love data, right? And I just can show you the data. And so I can't really, keep up with the numbers, but there's about 52,000 now confirmed killed, not really dead, killed because of the weapons. And out of them, we have 70% children and women. Right? This is well known now. There is no doubt about these numbers. These are the patients that, we're counting them as direct cause of the war, right? But remember that we have more than 10,000, patients with chronic diseases and cancer that don't have access to medical treatments like, radiotherapy or chemotherapy. They're going to die, or they died already. We're not counting these people. We're not counting people with chronic, kidney failures that they don't have access to dialysis. Our organization, alhamdulillah, we're able to send 33 dialysis units, but it took us more than 6 months.
6 months.
6 months to send them, right? From Emirates to Jordan. Then they stopped in Jordan for a while, and then we had a clearance. We then send them to the West Bank, and then they kept them in the West Bank, and then we had to do all these things with the Israeli part. And then they send them to Gaza. They're functioning now, alhamdulillah, and everything is fine. But 6 months it takes you. How many patients we lost with a chronic kidney, failure because they did not have access to dialysis and so forth, right? So the indirect numbers and deaths because of the war, they're even, in my own opinion, way bigger than 50,000, the indirect, right? So, and as I said, 60 to 70% of them are children and women. So this is indiscriminating between fighters or, people they claiming they are hiding here. And if you have any building in Canada, right, let's say it has 70 or 80% children and women, and then you have, let's say, one person that you think is a bad guy, right, hypothetically, right?
Yeah.
Are you allowed to bomb the whole building, right, and screw everyone in? But this is happening in every building, in every street, in every neighborhood in Gaza. Why this is allowed? So whatever you want to call it, I can give you the data. I'll leave, the term for you to call it genocide or whatever you want to call it.
Yeah.
But I can tell you that the data shows that 70% of those victims are women and children.
That's and what you said is very true. That any normal situation, we don't. This would not be an acceptable standard of conflict. Any normal situation, we would not do that. I remember there was early 90s. I don't know if you can look this up. There was an early 90s. There was a standoff with this was, I believe, in Quebec, with one of the indigenous tribes. Okay, can you look that up? This, I think, early 90s. There's a standoff. I remember, and I believe there was an RCMP officer that may have been killed. So there was one that was killed. The Canadian Army had the ability, if they wanted to, just go in there and just completely take over and do whatever they want, right? But they negotiated. They tried to minimize loss of life. Like I remember this. I was very young at that.
The Oka crisis.
Yes, right.
Lasted 78 days.
So it lasted 78 days.
Two fatalities.
And one of them was an officer, right? If I'm not mistaken. but it lasted 78 days. I still remember this. It was like a standoff, and there was negotiations that were happening. There's peace now. For decades, there has been peace. They negotiated with trying to get a positive outcome. So in Canada, we have something where people they're on a reserve, they have their land, they're still under the subject of Canadian law to a certain degree and so forth. There's a conflict, but as Canadians, we would never have accepted for us to go in with fighter jets and just bomb this reserve into smithereens, right?
100%.
So how do we as the world accept that? How does the average family accept that there are people being deliberately being starved and bombed and droned and just snuffed out of existence?
No, I agree with you. I think there's a double standard, but I think, to be fair, many of the Canadians, I'm again talking to my colleagues in Canada, that when they hear the stories from me, they change their mind.
Yes,
and I think
the average person, I agree with you.
Average person. So I think the Western media is still not doing a good job in conveying the truth.
What about politicians? Do you feel politicians?
No, not even politicians.
Yeah.
I think they are influenced. And they're not really saying the truth, or not really,
I notice a lot of them backtrack. They say something, but then they get threatened.
Yeah.
They get the screws put to them, and then they backtrack.
Yeah. And this is our role, I think. This is our duty, just to convey the message to them, and being consistent, persistent, and to say, this is what's happening. This is the truth. These are people coming from Gaza. Listen to them. And this is the data. We believe in the data. And let's just, come down to the data and say the truth to the average people around us, and act upon, as you said, our values of humanity and, decency, and all these good values that we have in Canada.
Do you see any hope with the upcoming elections for any significant change in terms of political stances and positioning? I'm seeing some different rhetoric that I didn't see before. So some of the rhetoric is changing, but you hope it's just not too little, too late.
Yeah, no, I do have hope, and I think, if you compare, how we can envision this conflict, in Palestine before, this war, and now. And at the beginning of the war and now, I think there's a lot of positive things. And I think the politicians and the people in the government, they are being encouraged to say the truth more and more. And I think we're going to see more and more people saying the truth and standing with the truth, and not really, having to fear, those who are really influencing them not to say the truth. And I do ask everyone to vote for the party and for the people in the parliament. They had a record of saying the truth, or at least participated in some kind of activities to stand with the people of Gaza.
And do you think that there can be some type of pushback against, when we have these conversations, to be automatically just blanket labeled anti-Semitic? Like, for example, I saw somebody shared a clip with me of one of the MPs who's running for re-election, and he said, okay, what's happening is a genocide. And then he backtracks afterwards and says, "Oh, I didn't want to offend people, and we need." So essentially saying that by calling it a genocide, it's being anti-Semitic. You know what I mean? Which makes no logical sense, but people lockstep end up following that same pattern of those who speak up. It's like they come up, then they say sorry, and they say, "Oh, I'm against anti-Semitism." I thought you were against mass murder. That's what you're talking about, not anti, anti any group. Yeah.
But to be honest with you, I mean, we just invited Ilan Pappé, right?
Okay.
A famous Jewish writer from Palestine, and he came to Toronto, and we had a great session with him, and he's himself is saying this is a genocide. And he said there are the top educated Jew people, they are calling it genocide, right? The fair and average and educated people. And unfortunately, I think we're hearing, the anti-Semitic and all these kind of terms from not a good practicing Jew, probably. There are people who don't want to say the truth. But if you hear this from Ellen Pepe, he would call it a genocide. He said, if this is not a genocide, what? So this is an educated Jewish writer who's calling it genocide. So he's not calling it anti-Semitic, when you say this is genocide. But again, there's lots of influence being put for years and years. But again, you compare this before the war and mid-war and now, I think there's a lot of positive things. I think things are evolving. I think what we have seen in the encampments and universities, the world has changed. The world has changed, and I think this brutal regime, ongoing oppression and killing, they can't get along without people recognizing that and people saying that this is wrong and it must be stopped. And I think more and more voices, you'll hear more and more voices saying this.
What can the average Canadian do?
I think advocacy is so important because we have democracy in Canada. And, if you hear about or you learn from the apartheid regime in South Africa, how did it fall? It did not fall with fights, right? It fell because of the mobilization from the youth, universities, and even at the government levels, when some Western countries, like we have good Western countries, we shouldn't say the West is all biased in this war. So we have Spain now, we have Sweden, Norway, to some extent. All these countries now are shifting, Ireland, Scotland, and I think Canada should shift, and we have to push. Our duty in Canada is to try to push our Canadian government not to be biased to any party, just to be biased to the truth.
Yes.
And to stick to the data and not to be afraid or scared to say what's going on the ground, what's happening on the ground, and to allow the media to say and convey, the true scenes from the ground. And I think we can utilize what has happened in some good Western countries, that they're calling it genocide, and they're saying we should cut our, ties with this regime if they continue to behave like this. We're not going to send weapons. We're not going to deal with them. This is how the apartheid regime in South Africa fell. And I don't care, to be honest with you, much that if the big countries in this globe did not change, because even in South Africa, if you read about it in the 1990s, for instance, UK and USA, they kept supporting the regime who was against the blacks and against the indigenous people of South Africa, against Nelson Mandela, and only in the last year or so they shifted, because there has been a lot of pressure and mobilization against that regime, and they had to shift. And I think this is going to happen. I have no doubt this is happening, by the way, because I can see the mobilization. I can see the effect of the people talking freely and saying the truth. There's a big price. And we're not paying the price. The people of Gaza are paying the price.
Yes.
But at least I think we should do our best in terms of continuing doing the advocacy. That's the least we can do. Of course, yes, contributing to organizations, to the medical groups like our groups. We're running multiple hospitals now in Gaza. We're running the Rentisi Hospital, the Indonesian hospital. There's a lot of need for, as I said, governments need to pitch in and play their role. So for now, I think, yes, we need to help all these charities and medical workers on the ground. That's something. But I think, yes, we can do a lot in terms of advocacy within our government and within our political system.
Yeah. What good is democracy if you're not willing to stand up for the truth? Because the assumption is that an authoritarian dictatorship survives on lies. You know, like
100%.
we've seen dictators.
100%.
Oh, he'll have a fake election. Everything's lies, right? So the election is, the election 99%. They want me, right? Everything's like, oh yes, he's the best leader. He does everything great. So there are many lies that need to uphold a dictatorial authoritarian regime, and so you assume that a democracy values truth more than lies, and that's why they have this system, because there are enough people that support the truth that people will do the right thing, right? And I agree with you that we have the opportunity, and I think more than ever now people are becoming aware, and that's why I think your story and your firsthand account, your firsthand witness of what you saw as an expert in the medical practitioner, very well qualified, many more degrees, than just undergraduate, bachelor's in English literature, right? So you have many more degrees than that. Now, what about, I think this is now a message to the Muslims. What now does the average Muslim need to do?
I think the Gaza people, they have done their part in this struggle against the occupation, and even trying to protect the Al-Aqsa, right? And it's our part now. We have to do our part. And there is no, excuse for us to say we're busy with a daily life, with my children, with this and that. I think, for myself, and I just gave a lecture in Mississauga to a bunch of physicians. I think we have to be a physician beyond the clinician. We just go back, just to the basics of your life. This life is going to end, right? And we're going to be facing Allah subhanahu wa ta'ala in the day of judgment, 60 years, 70, 80 years, whatever it is. If you just get occupied with your family, with your children, I'm not saying you don't have to. You have to feed them, you have to take care of them, you have to educate them, best education. But your life is going to end, and in the day of judgment, you will be asked what you have done for Gaza. I have no doubt, right? Every and each one of us will be asked about that. Every believer will be asked about that. And so I would say just give some of your time every day, like this podcast you're doing, spreading some truth about Gaza, right? Participating in rallies, advocating political level. You can do a lot, right? Lawyers can do a lot, and everyone documenting things, right? For us, we can go and participate in medical missions. If you can't go, I know many physicians, they say we don't have the courage to go. That's perfectly fine. You don't have to, but then contribute, right? We can't go and take 4 weeks off. Just contribute and give, charity to these medical organizations and charities that work on the ground. But make it part of your daily life. Don't just be occupied with just going to work in your clinic or for 8 hours and coming back, enjoy your dinner and watch the news. Oh, subhanallah, what's happening today? They're really suffering. May God help them. And I don't underestimate the dua. It's so important. I do dua every night for Gaza. Every night. I wake up just before Fajr, just 10, 15 minutes and make dua, because this is the best time for dua. But this is not enough. This is not enough, because we do have, alhamdulillah, the money. We do have the ability to talk in Canada. We do have democracy. We do have the education, right? So we have a lot of methods, a lot of tools within our pocket that we can apply to help our people in Gaza. So the people in Gaza did their part. It is our part to support them. It's our part to contribute and to help them.
How do you personally stay motivated with all this crushing despair, this, seemingly insurmountable, darkness that is consuming these people and what you have witnessed, all the trauma that you have witnessed? How do you stay motivated?
To be honest with you, I get my motivation from the people in Gaza. When I go there, I come back, and my wife, she noticed that it becomes more, motivated and a more positive person, right? It is hard when you go there. It's hard when you see what's going on. But it does energize me when I come back to Canada that I can do a lot for them. One day, even I was, in Gaza, and one of the guys, he showed me on his WhatsApp, he said, "Oh, thank you very much. they're doing rally now in Toronto. They're watching us, and they believe in the advocacy and the work that we're doing for them. So that makes me, even when I come back, to kind of feel even more guilty if I don't continue advocating and doing things for them. So the people of Gaza, because they are still, alive, and they believe that they will win at the end of the day, in the sense of that they're going to get rid of the occupation, get rid of the oppression, and live a normal life like any, human being deserves to live. That kind of high spirits, that what gives me the motivation, and makes me feel that I have to continue working for them. If they did not stop, I shouldn't stop.
Do you think this regime can break their will?
Which regime?
The occupying regime.
No,
do you think they can break the will?
I mean,
with everything that they're doing.
We have. I mean, it's a brutal regime.
Yeah.
But we have the apartheid regime in South Africa, and we're talking before this about Syrian regime, and I lived it through it. I went 13 years on medical missions to Syria. I've seen all kind of, aggressiveness and brutality and injuries, and and children being crushed even in the prisons. I've seen that. What happened to the Syrian regime? Where is the Syrian regime now? Gone, right? So we know that from the history. They don't last, right? 50 years, 80 years, 30 years, it doesn't matter, right? What really matters is the perseverance and the patience and the belief and the faith of the people. And whoever has the faith and the patience will prevail at the end.
Do you feel this upcoming generation in Gaza, there's a pathway for them to rebuild?
100%. I mean, the most important thing is to build the human being. And people of Gaza, I can tell you that when I see the women in the tents teaching, and despite all the destruction around them, despite having no food and a lot of injuries and tragedy around them, but they're still teaching their kids Quran principles and Sunnah principles. By the way, the people of Gaza are probably one of the most educated people on earth, and this is documented as well. And that's why probably they just destroy their universities and their schools, because they don't want them to get the education, because it's easy to handle them if they don't have education. But I've seen that, and so they are working on the human being, and I think this is way more important than the materials and the buildings and the destruction we see around. This is easy. We can rebuild Gaza, and I have no doubt we will rebuild Gaza and Palestine and the West Bank soon. But they have built the human being. They have built their children in a way that they will be, hopefully fighting for their rights. And as I said, the perseverance and the patience they have embedded inside themselves, it's just amazing, unparalleled. So I think that's what's going to make them, win at the end.
They have the spirit to endure and to rebuild.
100%.
And it seems a lot of that comes with their connection to the Quran.
100%. I mean, as I said, all the children that I treated, I asked them to read Quran. They immediately will read anything from the Quran, and this is something, it's a habit, it's norm for them. In the tents, when they're waiting, in the hospitals, in the ER department, it's just amazing how they are connected to the Quran. And this is what we're missing for sure.
Are there non-Muslim medical professionals that are being affected by this, where their eyes maybe or hearts are moving towards
we have
Islam?
I can't mention names, but I have some from Toronto. One of them hopefully will declare a shahada soon, that he went to Gaza, and he's seen that firsthand, and he said this is amazing.
Wow.
The faith and the iman, the belief they have in Gaza is just amazing. So he's being more connected now to Quran, and he's reading Quran. I have many stories, not only him.
Yes.
I have another lady, a psychosocial supporter. Probably I'm not allowed to say names.
Yes.
But I have a lot of stories that people went to Gaza and they've seen this firsthand.
So they're non-Muslim health professionals.
That's
they
right.
come.
That's right.
And these people that they've gone to help and treat.
That's right.
Their experience with them has caused them to turn to Islam.
100%.
Wow.
Yeah.
And they say that Islam is spread by the sword.
Well, this is not true, because you've seen these people now, coming from Gaza, and I've had friends, they went to Syria to help in the same thing. They went back to Canada. They said,
Yeah.
we want to declare Islam. So,
I think this is unprecedented. I don't think that I've seen any people on the face of the earth that they're looked upon as the victims, and they're so impressed by how they endure and their grace under this tyranny that they accept the religion of the oppressed rather than the oppressor. Because usually in history, you follow the oppressor, right? You convert to the oppressor or the one who has power. You follow them. But these are people who are highly intelligent, educated, coming to help, and they're so impressed that they're changing their whole creed.
Yeah, so I think, my own opinion, the more educated you are, the more likely to accept Islam if you just have the ability to see the truth. And I think when you go to Gaza, you'll see the truth. You'll see that the people of Gaza are the nicest people. You see them, that they're very generous people. They're connected to the Quran. They're very, helping, people. If they hear that you're coming from Canada just to come and do some surgeries and that, they will put all their resources, all their, food, everything they have, just to help you and to feed you and bring any material that will help your, presence there. So when you go there, you'll feel that. You will love the people of Gaza, and you will be connected to them. And none of the Muslim, actually, doctors or nurses that went with me to Gaza, none of them now, they did not want to go second, third, and fourth time to Gaza.
Wow.
All of them. They're applying. They want to go. They're advocating more than me, actually. They're advocating at all kind of levels for the Gaza people, because they lived with the, great people of Gaza, and they felt the oppression they're going through, and how they're great people.
Wow. One of my teachers once told me, he's like, be careful how you conduct yourself as a Muslim, because people will decide if they want to become Muslim. If in their mind, they're thinking, do I want to be like you? And I'm just thinking, here they see these people suffering, and they say to themselves, I want to be like you. I want to be with you, by their experience with them. So what kind of iman must they have that it's just bringing people like this?
Absolutely. And Allah subhanahu wa ta'ala, when He opens the heart of these people, nobody can shut it down.
Yeah.
And I guess they have seen, as I said, the truth, and their heart is open now.
So there is suffering, there is oppression. We have a responsibility, each and every one of us, whether we're Muslim or non-Muslim, and there's hope.
100%. I agree with that.
Jazakumullah khair for your time.
Thank you.
Dr. Anas, we appreciate your time and your continued effort. We're fully supportive of everything that you do. And we ask Allah subhanahu wa ta'ala to keep you steadfast upon these efforts, and allow us and others to join this caravan of goodness. And we should all feel that sense of duty to support, and not feel comfortable in our lives without that sense of duty.
Ameen. Thank you so much.
And to our audience, as always, we live by the Haqq, we die by the Haqq. And just when you think life is stuck, tune into Life Haqq. Assalamu alaikum wa rahmatullahi wa barakatuh.